Hey, future doctors! Welcome back to our USMLE Step 1 Prep Series. Question 7. Today we're exploring a challenging case of a 32-year-old man with fever and throat pain. Let's dive in. A 32-year-old man comes to the office because of a 2-week history of fever and throat pain. He is 173 centimeters tall and weighs 63 kilograms. His BMI is 21 kilograms per square meter. His pulse is 110 beats per minute. Respirations are 16 per minute, and blood pressure is 98/68 millimeters of mercury. Physical examination shows scattered 2 to 4 centimeter lymph nodes in the neck, axilli, and inguinal regions. There is a bilateral tonsillar exudate but no ulcerations. Results of laboratory studies are shown. Hemoglobin 9.6 grams per deciliter. Hematocrit 29%. Leukocyte count 1500 per cubic millimeter. Platelet count 60,000 per cubic millimeter. A heterophile antibody test result is negative. Which of the following is the most likely diagnosis? 1. Epstein-Barr virus infection. 2. Gonococcal pharyngitis. 3. HIV infection. 4. Lymphogranuloma venereum infection. 5. Streptococcal pharyngitis. Let's break down the key information in this patient's case. 1. 2-week history of fever and throat pain. 2. Physical exam, scattered lymphadenopathy and bilateral tonsillar exudate. 3. Laboratory findings. Anemia, hemoglobin 9.6 grams per deciliter. Leukopenia, 1500 per cubic millimeter. Thrombocytopenia, 60,000 per cubic millimeter. 0.4. Negative heterophile antibody test. This clinical picture suggests a systemic infection affecting multiple cell lines. Let's evaluate each option. Option A. Epstein-Barr virus infection. Epstein-Barr virus typically causes infectious mononucleosis, presenting with fever, pharyngitis, lymphadenopathy, and atypical lymphocytosis. However, a negative heterophile antibody test makes Epstein-Barr virus less likely. Option B. Gonococcal pharyngitis. Gonococcal pharyngitis can cause throat pain and exudate, but it doesn't explain the systemic findings of anemia, leukopenia, and thrombocytopenia. Option C. HIV infection. This is the correct answer. Acute HIV infection can present with fever, pharyngitis, lymphadenopathy, and systemic involvement, including anemia, leukopenia, and thrombocytopenia. The negative heterophile antibody test does not rule out HIV. Option D. Lymphogranuloma venereum infection. Lymphogranuloma venereum typically presents with genital ulcers and lymphadenopathy, but does not usually cause throat pain or systemic blood cell abnormalities. Option E. Streptococcal pharyngitis. Streptococcal pharyngitis presents with fever, throat pain, and exudate, but is less likely to cause the severe systemic symptoms seen in this patient. Therefore, the most likely diagnosis is HIV infection. Acute HIV can present with these systemic and localized symptoms, making it the best fit for this case. And that's how you tackle a USMLE Step 1 question involving systemic infections. Always consider the broader clinical picture and how different infections can present. If you found this video helpful, please like, subscribe, and hit the notification bell for more exam-crushing content. See you next time!